questions and to listen to our concerns. Come on, gentlemen. Come up and get a microphone.
I have three questions. I'm a senior citizen.
Right.
I'm retired. As part of my pension package, I have health care until I die as part of my pension package. I worked and I earned the right to that. What is going to happen to people like me who are retired?
All right.
And also, what is going to happen to people who are handicapped under this proposed government-run Obama plan? I think those of us who have read up on it know what is going to happen to us. We will be counseled on how to end our lives because the money will be taken from us. I will not be allowed to have the plan I already have worked for and have paid for and is part of my pension. It will be taken away from me. If I should have any kind of a major health problem, they will counsel me on how to end my life. People with disabilities, children with disabilities, their parents will be counseled on how to end their child's life. That's my first question.
Speed it up.
We're going to have to, as you can see, there are long lines at each microphone. I'll try to keep my answers shorter. I think I need to restrict you each to one question and try to keep your question a question because we have a limited amount of time. The answer to your question is, one of the things that's ambiguous about this bill is exactly what will happen to existing plans, except that the pretty clear language of the bill says every single plan in America, whether it's a group plan or whether it is an individual plan, will either go away or at a minimum will have to meet all kinds of new standards, mandates, dictates, and requirements in this bill. So I cannot, it's one of those questions, remember I told you up front, I'll give you the best answer I can give. I can give you no assurance that the plan you have will continue to be in effect and apply to you as it applies now if this bill becomes law. Yes, sir.
Speaker Shadegg, thank you for inviting us all here and listening to both sides of the debate. I have two questions that are both financial.
Rule is one, so.
First of all, I haven't seen anything in this bill whatsoever that addresses tort reform.
Very easy, very quick answer. In HR 3200, there is nothing that addresses tort reform. Republicans in the Commerce Committee offered numerous amendments to put tort reform in. All were rejected.
Get rid of the lawyers in Congress. And the lobbyists and the lawyers. Sir.
Lawyers have a long tradition in Congress. Secondly, under the bill or the legislation that you drafted, and that was spoken about a lot in the last election cycle, actually, with the tax credit for health insurance. How would you prevent fraud? How would you prevent giving people that $5,000 and not having them spend it on health insurance, and then at the end of the day they come to the hospital and say, I'm sick, and we still have to take care of them?
Yeah, very legitimate question. Most of the Republican proposals rely on a tax credit. What that means is that if you're paying income tax now, the government would let you take a portion of the money you would otherwise send in income tax. I think John McCain proposed $2,500 and $5,000. That is what I proposed, $2,500 if you're an individual, $5,000 if you're a family. Spend that on health care and then not send it to the government as taxes. That would be a tax credit. The answer is you could only get the tax credit if you certified that would mean your health insurance company would have to certify to the government that in fact it was spent to buy you a policy. So that's the way you would enforce the requirement. For those who get a refundable tax credit, the money would actually never go into their hands. They would select a plan with the XYZ insurance company, and the stipend from the government, or the tax credit, would go directly to the insurance provider. Because the rule is you cannot spend this money on anything but healthcare. As for how you prevent fraud, well, you know, fraud occurs in government programs, and you just have to be as aggressive as you can, but at a minimum, you would say it cannot be spent on anything but healthcare. Okay, yes, sir.
Congressman John Brammer, I too am retired military, been retired since 1980. Like my fellow helicopter pilot who spoke over here a while ago, I probably be on the Senate Obama list as well. My wife and I pay $2,500 a year for Medicare. What is going to happen to Medicare under this House Group 3200? As a follow to that, we also qualify for TRICARE under military. I haven't heard anyone on any news program, any newspaper article, magazine article, say anything about TRICARE. Now, would you make one comment about John Conyers and his inability to read 1,000+ pages?
Let me say something I should have said a lot earlier. As intimidating as this bill is, 1,026 pages, if you do go and download it, the guts of what most people would be concerned about, the individual mandate, the employer mandate, the penalty for employers, the penalty for individuals, the public plan, almost all of that appears in the first 50 pages. And it is not hard to read. It is confusing somewhat because it's written somewhat in legalese, but you do not have to have a law degree. And if Mr. John Conyers, chairman of the Judiciary Committee, can't read this without a lawyer, he better find new work, in my opinion. To be totally candid, not every member reads every bill. So a gentleman asked me a question a minute ago about cap and trade. Not a single member, not one member